Hi there, it's Tammy here, and in this short video I'm going to talk running during pregnancy. So this is actually after being sent an article on a woman running a 5.17 minute mile while 9 months pregnant. And I'll tell you one thing, running during pregnancy, like my powerlifting example, can be controversial. So again, I always love being sent these, so keep sending me these types of articles and reels because you know me, I love sharing my perspective on all things pregnancy, but even more so when something's, a little controversial, right? And before I go into further detail, I want to be transparent that when coaching my pregnant clients, I will typically err on the side of caution, especially when it concerns general population pregnant women, meaning non-athletes, because I always like to think of short-term benefit versus the potential long-term cost. So in the case of running, what are the benefits of running during pregnancy versus the potential long-term cost of running during pregnancy? And I say potential because, again, every woman is different. Every pregnancy and how a woman's body copes with the demands of pregnancy is going to be different, which is why I always advocate for safe and individualized exercise prescription that progresses with you as your pregnancy progresses. And in my eyes, I will always consider the potential effects on the woman's body of continuing to do something, right? And in the case of running, that would be things like her joints, which are being affected by the hormone relaxin. And a huge one to be considered when it comes to running is the pelvis and probably the spine also. Then you have the potential effects of running on the pelvic floor and abdominal separation, so on the abdominals. And my question would always be, is there another way to elicit the same response from the body in a way that minimizes the potential effect on things like her pelvis, her pelvic floor, and the abdominals? And my answer to this when it comes to running during pregnancy for non-professional athletes is a resounding yes. So there are so many other ways to get the same response, right? Things like using a bike or a cross trainer would be some of them, right? Doing conditioning circuits, which, over the years, I've given to many well-trained pregnant women. It's another way of eliciting the same response from the body. And based on this reasoning alone, I typically advise pregnant women, who aren't professional athletes to actually use alternate methods of training during pregnancy as opposed to continuing to run, right? And for someone who actually didn't run pre-pregnancy, I would actually advise against adding it to their pregnancy training routine. There's just no reason to start running during pregnancy. That's if you even can. Now, that's unlike strength training, of course, which I would absolutely advise women to participate in, irrespective of whether they trained pre-pregnancy or not. But of course, I'm always talking safe and individualized exercise prescription that progresses with you as your pregnancy progresses, as opposed to following, the free, generic online pregnancy workouts that you just kind of randomly find online. And there are, of course, many things to consider when it comes to running during pregnancy. And a really important one is the women's mental health during pregnancy, right? And why she wants to run. And I'm going to be really honest here because the reality is that some women do run to help with their mental health. And I've already spoken about exercise and mental health in another video, as well as how you can continue to exercise to support your mental health. So I probably won't be going into that here in this particular video. But this is actually a conversation that I really would urge any coach who trains pregnant women to have with their client before telling someone that they can't do something. And this is really important. And that would be, how would a recommendation to stop running affect your mental health? And how can I continue to support your mental health in a positive way that also supports your body in a positive way? So finding out the reasons why a woman runs and wants to continue running during pregnancy is very, very important. And from there, I would work with the woman to see if alternate methods are going to support her and her mental health in the same way. If not, then I'd absolutely advise the woman to get clearance from her healthcare provider and ask her to see a specialist women's health physio to ensure that her pelvic floor is actually strong enough to support her continuing to run and actually isn't going to be compromised by doing so. I'd then work with her to ensure that her strength programs are strengthening her to support this. And of course, we want to ensure that she's working to the correct levels and to the right distances. But again, I'd be trying to work with her to find alternatives that do elicit the same response from her as opposed to running. Now, in this particular example that was shared with me, the woman is actually a professional athlete, right? Or she's a professional middle distance runner who races for ASICs, competing in mostly 5 to 10K races. And I've shared my perspective on professional athletes during pregnancy in other videos. So if you want to check those out, head to my page. But in a nutshell, my opinion is that pregnant athletes are absolute outliers. And while we should be inspired by them, we shouldn't be adopting their training methodologies. And this also goes for the athletes themselves, not actually encouraging normal women to follow what they're doing. I think that's a really, really important point. So pregnant athletes continuing to train during pregnancy should not be encouraging normal general population pregnant women to follow them or their training methodologies. But that's a whole other kind of subject for another time. But this woman is no different, right? She is an absolute outlier. I mean, the fact that she can still run at this stage of her pregnancy is abnormal in itself. But when you look at the time that she clocked, I mean, it's a 1 mile in 5 minutes and 17 seconds. Just to clarify, that's 1.6 kilometers in 5.17 seconds, right? I mean, that says it all. She's not normal. That is quick. And just for fun, I did a little comparison from my days on the track. And just so you know, when it came to running, I was always more kind of short distance, and it was never more than anything, say, serious recreational level. And I never really reached a serious competitive level for my age at the time. Anyway, I did do a little comparison just for fun. And when we were in the off season building kind of the base, we did run longer distances. So I checked my diary that I kept during this time, and the last entry for a 300 time was 51 seconds. And after that rep, we actually had a 7-minute rest, and my next rep was literally 5 seconds slower after 7 minutes rep. And this woman ran just over 5 times that distance at pretty much the same speed, no rest, and 9 months pregnant. I mean, that one rep at that pace absolutely nailed me. I was cactus after that. But can you imagine running that 5 times over at the same pace at 9 months pregnant? I mean, to me, that is absolutely incredible. But the thing is, that's the difference between recreational athletes, normal people, and professional athletes. They just aren't like you or I. They are absolute outliers. I mean, this woman was running professionally before she fell pregnant. Her body is absolutely used to running. But again, the fact that she could even do this, keep running at 9 months, already makes her an outlier, even by professional running standards. That is not normal. And based on this article, she was cleared by 2 doctors to continue to train and cut back her overall distance and the intensity that she was working at, which actually says something if she's still running that quickly. I mean, that's insane. But she also does credit her strength training, which is amazing, and the alterations to it, which allowed her to counter the physical effects of the pregnancy on her body. And all I can say in this respect is we simply cannot view her and what she is capable of the same as you or I. and that I hope that she was cleared by a specialist women's health physio and under the guidance of her specialist women's health physio, and that her pelvic floor was being monitored in an ongoing way. And when it comes to the pelvic floor, we always have to remember, like any muscle, it can be tight or it can be weak. It can have more flexibility in it or it can have less. Like, it's a muscle, and like all muscles, it can be trained. And based on my experience working with women in their first pregnancies who strength train regularly, you know, they do tend to have tighter pelvic floors. I mean, I'm not saying that's everyone, but based on my experience, and you know, I have worked with hundreds of pregnant and postnatal women over the last decade, that's typically where women who strength train regularly tend to fall, which is another reason why I will always advise women to have their pelvic floors checked from about 16 weeks pregnant, so they actually have an understanding of where their pelvic floor sits and what they need to do to keep it healthy during pregnancy. But again, I go into much greater detail on all of this in the pregnancy process program, so I'm not going to go into that here. Now, from a safety perspective, let's look at whether it's actually safe to run during pregnancy or not, and what the research and the guidelines say. Now, we already know that the long-reaching positive benefits of exercise during pregnancy are well proven. And while running during pregnancy kind of falls under the same guidelines as any exercise during pregnancy, because it's still exercise. But let's be smart about this. When I talk about running during pregnancy, I'm talking about keeping your weekly distance and working capacity to a safe level. And remember, this is always going to be relative based on your pre-pregnancy capability. But we know that women should be medically assessed to ensure that there are no medical contraindications to exercise during pregnancy, and that without any contraindications, women should be encouraged to participate in regular aerobic and strength training during pregnancy, and that the frequency and the intensity should be relative to the individual, right? However, one thing that almost all of the research says is that exertion over 90% is considered dangerous, but currently needs more research done around this. But I mean, you know what? Good luck trying to find women that are prepared to put themselves into that kind of 90% area during pregnancy for the sake of research. I mean, I don't think that's going to happen, but anyway. Me personally, I quite like the 70% rule as an average, you know. The research also does show that continuing to run during pregnancy doesn't actually appear to affect gestational age or birth weight. And interestingly though, one thing that is higher in women who ran was assisted delivery methods, which is possibly due to the pelvic floor and an increase in muscle tone. Then the alternate kind of pelvic floor in running camp says that running can actually increase the intra-abdominal pressure up to 2.5 times more than normal. So this increased pressure can actually make those muscles even weaker. So you can see there's two camps here. And there's so many variables, and every woman is individual, which is why it needs to be looked at from an overall individual perspective, considering things like doctor's clearance to run, no medical contraindications, her pelvic floor health, the potential cost versus the short-term benefit. Is there an alternative that would elicit the same response? And what would stopping running do to this woman's mental health? And to be honest, when it comes to running during pregnancy, even though it's safe when kept at a reasonable distance and intensity, the reality is most women are just too uncomfortable, too out of breath to handle the impact of running on their bodies. And some are just in pain. So running just isn't even an option for them. And for those who can, there's a lot to consider and no one kind of blanket answer that suits everyone. Of course, if you're looking to start or to continue training in a safe and individualized way that does progress with you as your pregnancy progresses, as well as including support across all 4 pillars of health, then absolutely feel free to apply to join my complimentary but private community. The application link is in my bio. So that's it from me today. I hope this video helped, and I'll see you in the next one.